All right, welcome to SCR Connections. Thank you everyone for joining us. It is my pleasure today to introduce our guest speaker, Thomas Scharmen. Tom is the Community Epidemiologist at the Office of Community Assessment, Planning, and Evaluation for the New Mexico Department of Health in Albuquerque. He's also an adjunct faculty at the University of New Mexico's Department of Community Medicine, and he is the coordinator and founding member of the New Mexico Community Data Collaborative, or the NMCDC, which is a library of databases and a network of over 60 analysts supported by New Mexico nonprofit organizations and local agencies. And for those of you who read the description of today's session, the NMCDC is one of the main things that Tom is going to be showing us today. We're really excited that he's going to be doing a live demonstration later, so we hope everyone is looking forward to his live sharing of the application. So I'm going to go ahead now and hand it over to Tom. And let him get started with his presentation.
Good morning, everybody. Thank you so much for attending, and thank you to the SCR for inviting me. Today I'm going to, under the title of Public Data for Public Health Advocates, I'm going to tell you a little bit about the building and sustaining of our statewide data service here in New Mexico. And we're going to focus on the New Mexico Community Data Collaborative. And as Sarah mentioned, we'll be jumping back and forth a little bit from the PowerPoint presentation to the live demo. So bear with us, and we'll see how smooth that goes. And I hope that some of these things will be useful to some of you who are perhaps developing similar projects in your own local areas. And I would love to contact and talk with you about those projects and hear what you're doing. So what is the New Mexico Community Data Collaborative? Sarah gave you a little peek there. Here's a picture of our home page. We'll go there in a little while. We have, it's an informal network of analysts. Citizen analysts is what we train. They come from a lot of different nonprofit organizations, sometimes health provider coalitions or universities and local agencies. And we also share an online platform with a lot of content. And that content covers a lot of areas. But it's mostly a people network, not so much a data network. And mostly our main goal is to build community capacity to move data into action. So we spend a lot of time working together with people, training, doing workshops, and joint collaborative projects. And in New Mexico, we're also fortunate enough to have a Department of Health run indicator-based information system, which we refer to as NMIVIS. And this has been a very important development for our state over the last 10 or more years. It's an interactive query system, and you have access to public health data sets, in particular vital records data sets, looking at sub-county data, as well as demographic characteristics at sub-county level, and a lot of other data and profiles of different parts of the state, as well as health topic monographs, if you will. And so this is a topic perhaps for another presentation on this series, and I know the great person we have running this information system for us would probably really enjoy doing a presentation like that for this series. So what's it all about? I'm going to show you a quick example just using the slideshow, and then we'll do it again really quick doing it live. So if you all remember, I guess it was in January or was it February's webinar, Emily was the presenter, and she mentioned that we should be working with answerable questions when we work with community assessment. I thought that was a good way to state things. So the Valencia County Community Wellness Council is one of many health councils in our state county community health councils. We have them in every county, and we have them in most of our tribal areas. This group was concerned about youth issues, and we're wanting to catalog and survey what the services were. So they had a question about where are the services, and where are the opportunities for mentoring, and are they located where the need is, and how can we make these services more known out there to the public and more responsive to the needs. They developed this website. Well, this is the youth issues page on their website, and you find there a site assessment that was conducted by the Juvenile Justice Board in that county. Then they conducted an informal phone survey and to collect information about the resources. They also put together key risk factors from the Community Data Collaborative Library, and then they mapped these assets in contrast with risk factors, and then the resulting tool was taken out and used in community forums or sent to people, and a lot of the members of the council were able to use it in different types of meetings. Here's a quick look at one of the maps they made. This is the lower one on that page. And this is what we call a consumer-oriented finder map. It's meant for people who are looking for, well, where are those youth services, and how do I get to them, and how do I call them? And you can see how that works when an address is entered and it focuses in that area. And you've seen maps like this, I'm sure. But the same data has a use for community assessment and by community advocates. And here the same data, the little dots of the locations, are put in contrast to different background risk factor areas. So I am going to share the screen. I'm going to try transition here now. And if everything's going correctly, you should be able to see the live screen here. So you can see the data and reports that they put up here, contact numbers, etc. When we click on the Finder map, it shows up like this. I can type in just the zip code even here, and it'll go down to the other community. And this is the county just south of Albuquerque area, and it's two large villages, you might say, very farming-oriented community, but lots of low-income areas and, for instance, mobile home parks and things like that. So give you an idea. So here we focus on one area, and you can see it gave us 12 or 15 different choices. And here is a Eagle Park Recreation Center, and they do services, safe recreation. And here are the contact numbers. The other map is the one oriented towards community assessment and understanding how problems might be interrelated. So we have an interactive map here with our legends on the right. We can the background here is the population of children. I can change that to children in poverty. These resources, we can look at them here by clicking on them. The faith-based organizations are in red, and the youth mentoring are in blue, and you see you have the same information here. We can contrast that also with some other risk factors like juvenile justice referrals, and that get information about those referrals over a 5-year period. And also with youth living with grandparents or children living with grandparents. So this is the tool that they were using to tell their story, and very easy for them to develop with pre-made components. So let's go back to our presentation. So stop for a second here and let's do a quick poll. I'm interested in knowing from you all what kind of requests you receive for data that tries to focus in at small communities, sub-county, neighborhood, or an online service that you've used for neighborhood data. So you could enter this into the chat box real quick, and we'll look at those briefly. I'll give you a minute or two to do that. Thank you. Okay, I see a couple sources there, and I see an issue too. U.S. Census data. American Fact Finder is one that is very valuable, and you'll find on the New Mexico Community Data Collaborative, as well as on the IBIS website, you will find a lot of American Community Survey data. I'm not sure what IPEDS library info is. Maybe we'll talk about that in a second. So elder issues, I see two things on elder issues. We've recently been helping a group with the Aging and Long-Term Services Division here in New Mexico. Food deserts. That is one of our most requested type or area of data. We have sort of specialized in food and health issues because of the great demand for that. Vital stats, as I pointed out, is we have a great service here in New Mexico, the NMIBIS, that allows us to query vital stats forwards and backwards. Grocery stores. That's a lot of work. Now, that's the layer here in New Mexico that we had to go to 4 different agencies to get all the licensed grocery stores, and we still didn't get all of them because there's some of them on native lands. And then we had to do all the geocoding ourselves. I think it was only about 11,000 addresses. Asthma rates, very good one, yes. Chronic diseases is another common type of request. Just in the last year, we've started working a lot with transportation groups, metropolitan planning associations. Now, whooping cough rates. Sometimes we do not have very good data for infectious disease at a neighborhood level because of the small numbers. I believe this is our main challenge there. Obesity rates. Obesity rates for adults. There's a new tool that's on the CDC, the 500 Cities Project, which will allow you to look at, for cities, obesity rates from the BRFS by census tract. A lot of times people ask for data by zip code. It doesn't always come that way. Mental health, vaccination rates by school district. We actually have a layer like that. You can see it on both NMIBIS and on NMCDC. Social workers. Healthcare workforce is a challenge for us right now. We'll talk about that a little later. Well, these are great. These are great, and I saw perhaps more areas of issue areas, health areas, data type requests rather than online services that you're using for neighborhood data. What does it look like here in New Mexico? I'm going to move on here. Thank you for your input. So what do community-based data users need and want? What's happened with the evolution of NMCDC over the last 15 years or so is that it sort of started with my office and other regional community epidemiologists trying to supply data for a lot of different community groups. We work together with our health promotion staff. I'm actually part of the health promotion team for this public health region, and that's typically the way that the regional epidemiologists work. So we're in contact with all these different community organizations and coalitions that the health promotion team helps us coordinate or communicate with, and the demand for data was almost overwhelming for a very small staff. So we started, we didn't have a lot of options to decide what we would pre-make for them. We were too busy filling the demand. And 85% of those demands were for neighborhood level sub-county data. At the same time, people wanted more and more to be able to look at a wide range of issues, not just health outcomes, but the social factors like economics, education, crime, environment, et cetera, and assets, as well as the health outcomes. And then we found, as we get a repeated request, we would be so frustrated when we went all that work to prepare one data set for one county, and then 2 months later we got the same request for another 3 counties elsewhere. We basically eventually got the message that it was easier to do the data statewide. It actually is cheaper and faster to do processing of data sets statewide for every neighborhood rather than county by county. So who are the public advocates we work with? You can see a list here on the left. The first section is mostly people working in early childhood. And these are local agencies and coalitions. There's another group that is folks that are agencies or academic or government offices that are working with planning as part of their job and are responsible for doing that for others. And then there's a whole lot, as I mentioned, of people working with food and health and all the related things like hunger or obesity or access to recreation and even chronic diseases and things like that. And then there's a lot of provider-oriented coalitions, like the Alliance of School-Based Health Centers or the National Center for Frontier Communities. And a lot of them are working with resource directories as well as health-related, healthcare access-related issues. The way they use this data is basically to bring money to our state or benefit in the way of better decision-making and more participatory decision-making. And you probably are familiar with these types of uses and requests and probably help a lot with these things. Program planning and targeting, including grant proposals. In the last couple of years, we've helped with about a dozen health impact assessments. The people are more and more starting to see how having data is an excellent tool to add to your community engagement toolbox. And the maps make perfect needs assessment and gap analyses at a simplified level, if you will, a visual level. The backgrounds very often are the risk factors, as you saw earlier, and the foregrounds are the assets responding to that. And policy advocacy is perhaps an area that we need to work more in. It's difficult. There's a fine line, I think, to walk there between providing the data to groups without being overbearingly providing them the interpretation or judgment and allowing and helping them to use the data to come to those interpretations and judgments on their own. So sometimes we don't get the data we need, and maybe there's some like issues going on in your state or your county. Hospitalization. Well, some of these things all have one thing in common, and I should define public data here. It's not the same as big data or medical record data, for instance, although you can take big data and medical record data and other confidential data and convert it into public data. And so a lot of these data sets that we are working on are data that is required by law to be compiled by public agencies and workers and mandated to be returned to the public sector for multiple users and uses. And so some examples are licensing data of all kinds. That's always public data. Crime data of almost everywhere is public data. Data in the hospital inpatient discharge data system in New Mexico and elsewhere, we have that mandate that go back to the communities, and we do take it back, but only at the county level. We need to geocode it to get it at the sub-county level. And a lot of personal data has been aggregated by small geographies to protect confidentiality and can be invaluable for program planning, budgeting, and policy work. So some of the barriers that happen, we have in New Mexico, for instance, good policy and statutes on the books, but practice doesn't always follow that statute or policy. And some of the reasons are very practical. There's not enough resources or money or even training among state personnel. There's a lot of changeover. But sometimes it's just a lack of initiative or incentive or understanding their duty to do this. There's different authorities in charge with different priorities. And one thing that we're hoping is changing now with more and more emphasis on open data and more use by public and non-governmental organizations of that data. People are understanding what that public demand means and what applied research is as opposed to, academic research that's trying to prove something. We work to improve things more than to prove things. So confidentiality concerns are always important to be front and center. But if we understand aggregation and mapping process and how to work with small samples, we can allay those concerns about the work that we do, I think. So I'm going to give you, again, a quick, I'm going to slide over to the live version here, and I'm just going to show you a few things on our website to give you a little idea of what we do. So our main page is here. Please explore it. You can see how it presents some of the latest maps here, and also a link to the gallery. And then there's information about what we do to be found here, as well as contact numbers. You can get in contact with me. My phone number and email are right here. For people, anybody can visit this website, and all of these maps are open for anybody to explore. They don't need a subscription. They don't need to pay anything. And we have about 60 or so in this main gallery. Some of the items here are not maps. They are other galleries. The best way to find things is, for instance, to explore in here and read the little blurbs. This is a good way to start. Just the titles give you an idea of the range of data that we have, and the range of requests and usages that are going on in our state. So some of these are galleries in their own right. Oops, I'm sorry, I clicked on the wrong one. I wanted to show you here. This is a food and health map gallery. I was mentioning the demand for food-related data, and we found that public health framework around these issues helps to bring a lot of diverse groups together that really have common objectives, particularly when it comes to the data they need to make the case for funding or policy in their neighborhoods. There is also a link on the first page that leads you right to an automated search of the most recent working material. So you see here, these are maps in progress, or demo maps, or things that have been worked on recently by our members who have logins and subscriptions. And so if you are a map maker here, as opposed to just a visitor and user, you can see what your teammates are doing, and you can also use groups here. We have a group feature to set up a group to work with your team and to collect there the material you're working with. So I think I'm going to leave this at that, because we're going to come back here in a little bit to look at how we do sharing on the website. So here's a little question. You don't have to enter into the chat thing, but just to think about a second. We use this often to help people understand social determinants and the importance of social ecology in mapping. A lot of you know what is on a death certificate or a hospital record, but think about what's not on a death certificate or a hospital record. A lot of these things that we call social determinants. You know, it's not going to tell on a death certificate how safe your community was, or if you were abused as a child, or how much privilege you had or did not have. If you worked in a backbreaking, low-paying job all your life. That's not necessarily there on a death certificate, but it is what we call the social determinants of health, and it can be collected and measured at the neighborhood level, correct? I think we're all starting to do that more and more. And so one of the things that we sort of learned, and it's become a guiding principle for us, is that these methods, working with geography and geospatial analytic methods, are somewhat inevitable. If you want to look at the social determinants, you want to look at health equity and disparity, you're going to need to use social ecology. You're going to need to focus on place and communities and neighborhoods, which are, after all, the natural analytic units of public health. And place is what links elements that are not found together in a single set of data. So we end up going towards social ecology inevitably, but it requires geocoding of addresses and aggregations at the community level. And this is a lot of work, and who's going to do it? So geography is key. You have these data sets that are confidential, they're patient, client, student data. They have to be converted to latitude and longitude using geographic information systems. Then they become aggregated at community geographies, and they can be released and used by a lot of different partners and actors in public health. So this also allows data to be correlated with social determinants, and also allows us to do visual presentations. And so geocoding is the actual work converting addresses to latitude and longitude coordinates. Here in New Mexico, we've developed a statewide single address file with, thanks to funding that the indicator-based information system at DOH has received. We've developed special directories, we've trained staff, and we've been taking a lot of patience to do it. So imagine a couple data sets of 50,000 addresses, and you run them through these automated processes, and you get maybe 90% of them. Well, that only leaves about 5,000 addresses that you're going to have to go through and look at one by one, and maybe be able to manually correct and geocode. And so that job is very important. Quality geocoding does consume resources, but the flip side of this is that poor quality geocoding probably consumes more resources. So this is something to consider if you are working towards this type of project. So I mentioned I was going to talk about sharing. You know, we're a collaborative. I think we are a true collaborative. At the core of collaboration is that 5-letter word labor, and it is very much hard work. But at the heart of collaboration is sharing. And so we try to maintain these principles, maintain our fidelity to these principles of sharing the data to anybody who wants them and needs them as a legitimate use for them with no charge. We should try to share the work also and train people as we work. And we found that if we can communicate well, we can save the taxpayer money, because we found examples of 3 or 4 agencies geocoding, for instance, the same exact data set and not even sharing it with each other. And then training and teaching each other all the time is very, very key to what we do. And so we're lucky enough also to have an online platform that is built for sharing. And this is the ArcGIS Online Services, AGOL, we call it sometimes for short. This is a schematic of how our platform works. Below this green row of squares is our platform, our piece of the platform, our online organization, if you will, New Mexico Community Data Collaborative, with our analysts. And each one of these orange icons represents a data set, if you will, with, you know, more than 5, 10, 15, 50 columns of information or indicators that are ready to be mapped. And our members can use the tools that are online and to build a map using almost instantaneously those features and adding them to their map. And even better than that, there are other online organizations. That's what the top row of icons represents. The USDA has its own online geoservice and opens its server to other ArcGIS Online users and even users on other platforms. HUD has one, EPA, HRSA, the city of Albuquerque here has one, and the New Mexico Department of Transportation has one. So our map makers using this platform can just grab layers or files and add them in less than a minute, 90 seconds it takes to do it. I'm going to show you in a second. And then once they have maps made, they can publish those maps, they can embed them on other websites, they can actually convert them into different types of applications. I mentioned story apps and crowdsourcing applications, comparison applications, finder applications are all pre-built and ready to go online. And then, of course, we have the administrative tools that help coordinate our team. So among our challenges are providing these incentives for sharing. We have lots of people using our content, but will they contribute new content? And this is kind of like a primitive library strategy, if you will. Everybody who comes in to check out a book gets asked if they have a book they want to donate. That does happen a lot, and that is how you build your collection. But obviously you have expert users who can really write or really build a data set and share it. So trying to get people to do that is a challenge. And another thing that we're finding is that there's a lot of great platforms out there that do not have near the content that we have developed and for New Mexico with our two projects, or don't even have a lot of content that is, like I showed you there, that's being shared by other agencies, federal agencies, and other states. So I'm going to transition now into another demo real quick here. Let's click the right button. There we go. So I was showing you how we could find things on here. I was showing you that we have this type of map gallery. I want to show you another map gallery here. Oops, grab the wrong one. This is the early childhood map gallery and gives you an idea of the range of data that we're using and the different types of applications that we're using online, right? So I'm going to use one of these maps. I'm going to use this one called Risk Assessment for Early Childhood Health and Development. I'm just going to go ahead and open that. It opens in a new window, leaves the gallery open for me. And the maps open in our standard working viewer, if you will. You can use a lot of different viewers here. But just to give you an idea of how not only a viewer can navigate this, but how a map builder, a map maker, can use this. And I'm going to take about another 5 minutes or so, and then we're going to go to Q&A. So the map opens like this. You can jump right in. You can explore it here. You can type in an address up in this area here. Let me see. Las Cruces, I can do that. And it'll take us down there. What we're showing on this map is juvenile justice referrals again. This is the background, and it's got a ranking here of an overall index that is part of this risk assessment. So if you want to see something else, the legend that it opens with shows us where what active layer you're seeing. But over here on content, to the left panel, you can see we can turn on and off the different features or layers, as we call them. And this is the key one for this map. This was a joint project put together by almost a dozen early childhood agencies and organizations to look at how to assemble a risk index out of key factors. And so they made the decisions about what these factors would be. Each one of them is here, you'll see. And some of these are come from our vital records data sets. Some of these come from American Community Survey. Some of these come from our own work, Geocoding. For instance, this one here. You can turn this on. And then we can also lay across the top. This is child abuse we're looking at now. I can shift that to, say, over here to Roswell or back to Albuquerque. I can overlay across the top. For instance, here's all the pre-kindergarten signs. And so here we have, or here is kindergarten ready. So you see how you can contrast assets and things to risk factors. Now, if you're a map maker and you say, oh, I want to make a map that highlights or emphasizes one certain aspect of this data, for instance, what I've just turned on, child abuse and kindergarten ready, I can just save it as my own map and start to modify this map, give it a different name, give it a different location to pop up automatically, change the pop-ups that we're looking at here, change what it says. I can look at this one here, and I can decide what I'm going to show here. We can even show in here pie charts and things. But also, if I'm making my own map, a separate map, and I come to this one because I was wanting to say, oh, I would like to have this layer on my map. You see how I have controls here when I hover over the title. And when I click here, I can actually go track back to see what this layer, where it comes from, what it consists of, what else it can do for us. And this is a very complex layer, very complete layer, and it's actually in its 5th installment in 6 years. to tell you the truth, because we've been doing these, what we call early childhood investment zone assessments since 2010 or 2011. So you can see it's got the sources here, who to contact to find out about it. Here's a data dictionary for the users of the layer, and I can instantly put this on a map again. All the user has to do is pay attention to some of the tags for this thing, or a key name like this. This is a coded name, so I can come back here. I can add to a map right here, a new map. Imagine I'm doing, and I'm going to add from my own organization that I'm a member of and have subscription rights, and I just do it this quick. I find here there's two here. What's going on here? I can look at this one. Oh, this is the 2015 version, and here is the 2016 version. I add it to my map. I'm done. Coming back here, I can turn that off, and I can see the layer I've added right here at the top. Now I can go in and give it a new name. I can set up what attribute it's going to show, how the drawing, the colors will be, the legend, distributions, etc. And I can filter it if I want, and I can configure the pop-up here or set up a new graph or pie chart or whatever. But another thing I can also do, I can search here for, let's go to, for instance, I'll try something here and go to EPA, but not among my organization, within the ArcGIS Online community. And now, this gave us 1,300 results. EPA is kind of a very, very general search, right? But you get an idea of all the stuff that's ready to go on here. Now you have to sort of vet all this before you get it on here. But some of the sources are standard ones like the EPA itself, you can see, or ArcGIS services, or organizations like Frac Tracker, et cetera, et cetera. So that's to give you an idea of how we can share practically. I want to show you here, I think I have it here. This is sort of in my way here. So here is a list of our collaborators. Administrators and other collaborators can go in and see who's doing what here. I believe I have a link here. I'm having trouble getting at it here here's the open data page for ESRI, which is, of course, the parent company for ArcGIS Online. And you can search this for the open data sets they have there. So the sharing and the working together is very key to what we do. So I'm going to go back and draw this to a close so we have plenty of time for some discussion, because I'm anxious to hear what you all have to say, and we can show you some more things if you have a question that concerns that. But let's open it up now for discussions, and those questions, comments, etc., can be put into the chat box. And please remember to address that to all participants. While you're putting your comments there, I'm looking at the list of attendees, and I'm very pleased to see we have almost 60 people tuning in. Thank you all. I do encourage you all to get in touch with me if you have a project or issues similar in your own local area. I would love to find out what you're doing and be of help if I can. Okay, I'm looking at some good questions here now. So we do trainings a lot. That's one of the main things we do. We probably every other month at least, we have workshops where we have 20 to 40 people present, and then constantly we are working with one-on-one or with small groups of 2 or 3 folks to train and develop their data at the same time. The ArcGIS Online subscription services vary in cost depending on how large an organization are. Our subscription service there is less than $10,000 a year, but that includes an educational administrative discount, which Esri is very generous in helping us with. We have, I don't know, 5, 10 gigabytes of storage space there. There's software, and we have 100 slots for users. And we usually, in the last couple of years, we've maintained that pretty close to full, but people come and go. But anybody who consults or goes there, it doesn't cost them anything. We get charged small credits, but we've never used up all our credits in a year's time. Similar tools in other regions. One that I can think of, regional ones, is healthycity.org, I believe, is in the LA and has maybe expanded to all of California by now, but a fascinating project that's really well advanced, and it's got a lot of the online participatory forums that you would hope to have to work in groups and teams remotely. So there are others. Of course, there are national platforms that have a lot of data on them, like the what's it called? The county rankings and the community commons. Those are very good ones. Here in New Mexico, we also have Share New Mexico, which I mentioned very briefly, but it's basically a resource directory and a place for nonprofit organizations to sort of learn about how to network and how to write grants and get noticed. Public libraries, a little bit, more and more, and particularly with the Health Sciences Center Library at the University of New Mexico. And I was very pleased to go to the State Library Association's conference last fall and was surprised how much I had in common with so many people there. I never thought of myself as a librarian, even though our office where I work out of is a clinic in North Valley, Albuquerque, right next to the public library. How do questions usually come in? I get emails from people or calls, if this is what you're referring to, for data requests. At one time, I went back through my logs and counted 172 requests in an 11-month period. That's sort of where I drew out that concept that most of them, 85%, wanted sub-county data. Yes, I would love to talk with the people in Las Cruces about how the libraries can use this. So let me know. Please get in touch with me, the folks in Las Cruces. Any reason for using ArcGIS Online versus ArcGIS for Portal? I really don't know the answer to that question because I'm not familiar with ArcGIS for Portal. We started at the beta version of HGOL and sort of we grew around it. And we're not really high-tech people, most of us. We don't, we're communicators and teachers and with a little bit of data skills, mostly basic descriptive data skills. So perhaps they are just as well. I will say this that I mentioned about a lot of platforms out there. For instance, people talk about, well, I don't think I'm going to use the New Mexico Community Data Collaborative. I'd rather use Tableau. Well, that's like comparing apples and oranges. It's like saying, I'm going to use a spading fork rather than come and eat at your garden, because that's what we have is all the content there, and you can use that content with Tableau if you want. You can use that content with other types of software and online services, but those services themselves don't necessarily provide the content. How is all this data collection, data crunching funded? Yes, well, it's not necessarily funded. What sustains us is the fact that we have collaborators who donate the time that perhaps they are paid for by their own organizations. For instance, shout out to the Prevention Research Center at UNM. Shout out to Share New Mexico. Big shout out to Department of Health, which allows me to use more than half of my time to help coordinate this and train people to use it. And other agency analysts in Department of Health and elsewhere. But also a lot of people in the community organizations. We do have several small grants. Right now we're running on less than $30,000 a year in funding. That helps pay that subscription fee, and some contractors who help us administer the website, but mostly to help train and build data sets. Internal use, yes, we use that. You can set this up for internal use. For instance, there are maps there that you're not going to see. There are data sets there that you're not going to see. I'm pretty convinced that the security on ArcGIS Online is just as good as, for instance, the network that I have right here in my office. But we don't put confidential data up there. But we do have, off-centered point data very often that's set up for a private group and secure location where we can share it with people remotely, and we can strategize on how to do the aggregation. A lot of times we try to do that together in person, but when we can't, we can do it that way. So internal use, yes, definitely. So how are we doing for time? I've got time for some more questions here. If we have county convenient sample data by zip code, could we merge that data with an existing law enforcement map? Well, there's no problem with having 2, 3, 4, 5 layers on one map, as you saw, and those layers being different geographies. Very often you'll see on our maps layers at the census tract or layers at the small areas. I'm not sure if I mentioned the small areas. That was a creation here in New Mexico, Department of Health, that we used in order to make a little bit more stable our geographic units, and they're essentially just 4 or 5 census tracts combined into a new geography. But zip code, you can get more and more data by zip code nowadays, and people know their zip code. So you could have a zip code layer, and you will find those on some of our maps, and you turn it off and turn on a census tract layer that might have complementary data. So you're not really merging the data. You sort of have alternate layers that can be toggled on and off on the same map. I hope that answers your question. So let me see if I missed anybody's question. They were coming pretty fast and furious there for a while. So again, I thank you all for tuning in today. I would really love to get to know more about what you all are doing and tell you more about what we're doing here in New Mexico. I will pass the ball back to Sarah now so that she can do the evaluation and housekeeping that will close this out. So thank you all again.
Great. Thank you so much, Tom.
Oh, you took it back. I'm sorry. You got the ball.
Yes, I took it back.
I will mute.
All right. Thank you so much, Tom, for a wonderful presentation. And I hope everyone enjoyed it. I'm going to go ahead now and stop the recording.